We take you now to the Western Cape, where Health MEC Nomafrench Mbombo will join the rest of the world to commemorate World AIDS Day. Mbombo will be at a shopping mall in Cape Town, raising awareness on the pandemic that's raging on. For the latest, I'm joined by Athi Mtongana, who is there for us. Athi, very good morning to you. The Eastern Cape, we're looking at snake-like queues where there are several challenges when it comes to accessing adequate health care. What's happening there in Cape Town?
Well, I don't want to waste any time because the program has started and the MEC is one of probably the speakers here today. MEC, won't you then talk to us about why you specifically chose this particular location, and do you think that there is enough awareness around AIDS and HIV, particularly here in Cape Town?
Yes, thank you. There are other events that are happening throughout the province and also even throughout the metro in creating awareness. But here in the Belhar Airport Mall is one of the busiest, not only for the communities coming from the Belhar, but also in all other areas. That's why it's called Belhar Airport Mall. And if you go through all of these in these stations, you'll find that there are many people who are queuing. And noting that it's not only for the HIV/AIDS, but we put all the packages because some of these, they also impact on HIV. For example, I've got a station for the gender-based violence, a station for Men Up, for uptake of the male medical circumcision, a station for just for the general screening of the other conditions, for example, checking your blood pressure, checking your diabetes, and all of those. So we have to put all of this. And then lastly, we've got a vaccination station as well. Noting today also it's official at a national level to initiate additional dose for those people with immunosuppressed conditions, of which is HIV is one of those. When you have less than 200 CD count, you could be able to get another dose. If you had one J&J, you can get another J&J. If you had two of the Pfizer, you can get another one, but you'll need a referral for such. So it is exciting to be all under one roof. And gone are the days now when you go inside, like you have a hall or bringing people to the clinics. Now we go to the people.
Do you think that there is enough awareness around HIV and AIDS, considering that in the African continent, most people on a daily basis still get infected with HIV? Do you think that there is enough education around how to prevent then those who contract HIV?
We came as far in regard to the HIV, AIDS, even awareness. It's a pity now with a COVID pandemic, it has impacted on that. For example, in terms of our stats in the Western Cape, with a 90-90-90 strategy to eliminate HIV/AIDS by 2030, which is the framework for the whole world. 90%, the first 90, we're fine with that in terms of the people knowing their HIV status. So it means that people can even go and test. And remember, now we also have got self-testing kits. So we're doing very well. The second 90 is where we've got the challenge, where we are still in the 60s, meaning to convince those people after being tested to uptake of the ART. This is the one that we have got a challenge, which is even actually across the country. And then the third one is other 90 in terms of the viral suppression. So we've got all other interventions where we can be able to check that. Now, coming back to the second 90, how do we ensure in terms of the remedial to make sure that we at least we make it a point we respond to that challenge? Some people, especially during the COVID, they were unable to come and fetch their medication. So therefore, that's why we have come up with the lockers, also with the trailers, and also bringing this back to the people. The other part, the adherence club, because when you are part of the support group, it makes it easier to talk about all of these issues. And then the third part is about what we call the Welcome Back campaign. And some people find that they will have explored to have ARVs, but they found that, let me go to my traditional healer, or these things because I'm going to take them for the whole of the world. Let me experiment on other herbs. And then they are reluctant to come back. So that's why with the Welcome Back campaign is about, don't let those people wait longer. especially when now they go to the clinic. Some of them might go there to the receptionist without being part of the long queues, can say like I'm Karabo or whatever. And then immediately that person can be able to jump the queue, because that is very crucial. And then the other part is about to also use those people who are diagnosed with TB, also check them for the HIV, because normally these are the twins.
I want to let you go then, MEC. Just briefly, what are we looking at here in the Western Cape with regards to this new variant? How is it affecting the numbers and the positivity rate generally here in the Western Cape?
Yes, the numbers are increasing. We are still on the alert. We are not yet in resurgence. We are not yet in the fourth wave, because our numbers is it's still less than 20% in terms of the cases. But the positivity rate has increased. The reproduction has increased. And we have seen this in this number of cases, especially in the metro. Luckily, all three waves has taught us to be ready in terms of the health facilities. Our beds are still there. The vaccination, which is still now, we have to make sure that actually we mobilize as many, especially the over 50s who are in the remote areas, in the informal settlements, in the farms throughout, because as we know that if you are over 50, and also you have got COVID, the high level of hospitalization are there.
Thank you so much, MEC, for your time. The health MEC here in the Western Cape, Nomafrench Mbombo, she is leading the celebration or the commemoration of World AIDS Day today in the Western Cape, and there is a hive of activity, I can certainly tell you, at this mall in Belhar. There are various stations that have been set up to create awareness, and as she pointed out, it's not only raising awareness around HIV and AIDS, it's also organizations that help communities deal with issues like gender-based violence. We see that they've also set up shop around here, and they are engaging the community members that have come out to listen to what the MEC will be saying, and as far as raising awareness about HIV and AIDS is concerned.
Very well, Athi Mtongana, let's leave it there for now as we continue, of course, looking across the country where our reporters are stationed as we commemorate World AIDS Day.